Davide Vigano, and I'm co-founder and CEO of Sensoria. We're excited to be a finalist, and let me introduce you to our amazing team here. I don't have time to walk you through, but we're former Microsoft. We spent a combined 50 years of our lives, professional lives at Microsoft and Intel, and we're building a full platform powered by remote patient monitoring and AI technology to monitor patients at home. It's a truly wearable technology that can be embedded into garments and footwear. We built a full system which is a cloud plus mobile software system, but we have also delivered patented hardware products which are comprised of textile sensors and proprietary microelectronics. The solutions that we're building are related to solving real problems. There is a gap in the US, and not only in the US, related to the growing aging population and the available number of clinicians. In the year after the pandemic, 22,000 physical therapists resigned in this country, and the aging population continues to increase. The challenge in monitoring patients asynchronously and remotely is the lack of technology that allows a clinician to monitor gait impairments. We have built those solutions, and I will walk you through some of these examples. The opportunity is substantial, growing from $72 billion this year to over $207 billion in 2028. The solutions that we have delivered I'm trying to actually, in a concise way, summarize them here in a single slide for you. You can see that we can actually inject our sensing technology into whatever the patient decides to wear in the morning. We all wake up in the morning and take a shower and put our clothes on. We have smart socks, smart diabetic footwear. We have and can enable any type of knee brace to become smart. For people in a wheelchair, we can monitor pressure relief exercises all through mobile applications designed with behavioral science to encourage adherence and monitor quality of the rehabilitation for the patient. And then we built a full cloud architecture that allows a clinician to monitor each patient remotely. One example of our technology, as I mentioned, is our smart socks. They are comprised of 3 textile pressure sensors and the full 9-axis IMU. And as you can see, we can monitor range of center of pressure and balance, and all the primary gait metrics, cadence, time on the ground, the step time variability, and so forth. We've also worked with prestigious academic institutions, including the Michael J. Fox Foundation and Shepherd Center in Atlanta. And we're now monitoring both Parkinson's patients and MS, multiple sclerosis patients, successfully. We're working with some of the top pharmaceutical companies on their clinical trials. Another example of our technology is our smart boot for diabetic foot ulceration. In this country, every 20 seconds, there is an amputation related to diabetic foot. We have built a full system. You see here the product is called Defender, and all of our sensing technology, all the mobile applications, and all the cloud infrastructure is Sensoria designed and built for them. So Defender is a OEM, a B2B partner for us. And as you can see, both USC Keck School of Medicine and the Baylor College of Medicine have published independent research studies validating that we are superior now to the gold standard. In Europe, we're working with the largest knee brace manufacturer in Southern Europe, in Switzerland, Germany, and Italy as well. And they're leveraging our technology to monitor rehabilitation of the knee. Both ACL reconstructions and total knee arthroplasty patients can be monitored from home using our Sensoria Core microelectronic device to monitor range of motion of the knee, but also self-reported patient data. You see some of our amazing partners and customers on this slide, and as you can see, we have already delivered an aging in place, truly wearable artificial intelligence platform, and we look forward to working with you all to make it available to more patients, both in the United States and worldwide. Thank you, and we look forward to your questions.
All right. Outstanding presentation, Davide. Thank you for that. And first up, we have a question from Glennis, who will lead the way on the questions for the judges.
Hi, another one about the go-to-market model. So it seems like your focus are strategic partners, whether it be big pharma or OEM. What are your plans to go direct? And also, another question is specifically, what is it that your device is measuring? Is it pressure? Is it EEG? What's being measured?
So let me answer your second question first. So we can measure anything and everything that a researcher or a clinician asks us to monitor. So in the case of the SOC, you're absolutely right. We monitor pressure, and we also have a 9-axis IMU at the ankle bone level. So we actually see the movement of the limb in space. So think about a post-stroke scenario as an example. You want to see the inside-out movement of the leg as an example. You want to see the foot landing of the foot on the ground. So depending on the scenario, we always monitor one thing: adherence. Patient compliance matters a lot. So we try to inject the sensors and simplify the experience both for the patient and the clinician. We all wear socks, shoes every day. So instead of asking the patient to change his or her behavior, we actually inject the sensors into whatever they decide to wear. Number two, the non-mission specific piece of electronics that you have seen on the sock and on the boot has 7 open channels. So we're now actually testing temperature sensor, humidity sensors, sweat composition sensors. So depending on the chronic condition and the scenario, we can collect this data without changing the PCB, the electronics, which of course allows us for scalability across multiple scenarios. Yeah. As you know, it's very expensive to build a single solution. We think that the way to solve this issue is to build a platform with modular components from the textile sensors through the electronics all the way to the cloud.
Okay, great, thank you. And what about your go-to-market focus? Are you focused simply on B2B?
Think of us as the Intel inside or the digital transformation engine of footwear, accessories, and analog devices that patients use every day. So yes, our primary goal is to work with OEMs, very much like Defender is a Florida-based company, but we also are able to deliver direct to enterprise and direct to consumer solutions. So we work with some of the top pharmaceutical companies in the world, and some of our solutions are actually available direct to consumer through our website right now.
Well, thank you.
Fantastic. Great questions. Okay, Yasmin, you're up.
All right. I'm going to go to IP again. So talk to us about what IP you have, as well as I see that you're looking at partners. Have you even looked at partners in the fashion industry that are working on adaptive clothing? I'm just curious, how far and wide are you going to find partners and your IP, both?
No, those are great questions. I think, from the IP perspective, we were fortunate enough to be able to secure very broad patents. So the SOC, as an example, is protected by 3 worldwide utility patents through PCT rights. So not only we decided to actually keep the textile sensor as a trade secret. We don't want to share how we build our own textile sensors. Why should we make it easier for everybody to do what took us 6 years to do? Build textile washable sensors is very challenging, but we decided to actually obtained and secured protection for the full system. So the whole SOC is protected in that case, just to give you an example. And yes, again, we are the Intel inside of fashion. We think that fashion will come next. There is an urgency to fill that gap that I mentioned between the aging population and the lack of clinicians. That's what we called the Sensoria a few years ago, is sensor fusion plus IA. I'm from Italy originally, so IA in Italian means intelligenza artificiale. So now everybody talks about it, but there is no AI without data. So we want to combine, quantify the data fusion from sensors with voice data coming from just the clinician, but coming from the patient. Now imagine a time-stamped view of how I feel today combined with the data that come from my clothing. that will enable clinician agents that can augment the clinician. In the healthcare industry, we're lucky that we're not disintermediating job. We need more people to actually take care of the aging population. And so I call this beneficial intelligence instead of artificial intelligence.
I have one more question, and this is regarding your grant that you got from the Parkinson's Foundation. My mom had Parkinson's, so I know all kinds of use cases for this, but how did you convince them to fund you?
It was a journey. As you know, they're a wonderful organization. We obtained a $2.5 million grant during the pandemic. It was a challenge to recruit Parkinson's patients during the pandemic, but the beauty of the work with the Michael J. Fox Foundation is not just diagnostic. We think that there is a therapeutic component. Let me explain what we're doing. You can probably see my sock here, our sock here. Yeah. We're adding little Tesla haptic motors to the sock. So it sounds like you know a lot about Parkinson's for your family history. We can unlock freeze of gait. There is actually a great article that I can share with you, an IEEE article, thanks to the work that we have done on patients in Australia during the pandemic, that actually allows to know that if we engage those haptic motors with the frequency and intensity designed by the neurologist, we can actually unlock freeze of gait, which is the reason why most Parkinson's patients fall on the ground.
Yeah. That's amazing. Thank you.
Thank you. Thank you.
Outstanding. Good questions. And then Tiffany, you're up.
Yeah, great. Can you also talk a little bit about the patient acquisition strategy and maybe what what you plan on doing in order for the patients to continuously kind of use the devices over a period of time so you can track longitudinal data?
Absolutely. I think that's why our B2B strategy is so crucial, right? Most of these devices right now that patients wear, think about diabetic footwear, do not create any type of knowledge right now. Mm-hmm. So it is incredible. We know what we don't know, Tiffany, right? Which is fascinating. And that's a lot, unfortunately. Freeze of gait is a great example I mentioned before, but adherence, we're asking patients that suffer from diabetes and suffer from peripheral neuropathy, so they don't feel their feet normally, to tell us about themselves, right? The patients are not equipped to answer those questions. We need technology to help answer those questions. So by injecting the technology into great products, like, again, this is the Defender product. It has been designed by Nike. The same Nike designers that designed the Air Jordan designed this device. It's great to look at. It's easy to wear. It's not a stigma, right, to be wearing this device compared to many other offloading devices in the market that look, quite frankly, less than great. So we're trying to combine behavioral science, data fusion, but also the fashion design. There's like, I want to be seen wearing this thing, right? So it becomes actually a good conversation for me, not just an expression of my weakness or my pain, right? So which is one of the reasons why medical devices have a much harder way to monitor adherence, right? So it's adherence is the one thing that we constantly monitor. So our goal is to partner with companies also that do remote patient monitoring traditionally, like Livongo was mentioned before. Why are we just monitoring traditional medical devices when we can also monitor and create novel data sets like gait? The science of locomotion was, it was defined in the mid 1600s. It's called the sixth vital sign, and we still don't have a medical device to collect degradation of gait for neurology patients. Why?
Fantastic. Well, thank you again, Davide, for a great presentation and wonderful, wonderful product.